Why do some people say antidepressants saved their life, while others say they nearly destroyed it? It turns out the answer lies in three commonly overlooked phases that most people on long-term antidepressants will eventually go through. And so today we're going to be discussing these three stages and what you can expect to go through. Stage 1 is the honeymoon phase. This is the first phase of being on the drug when the medication seems to work really well. Now, for a drug like an SSRI, the typical early effect is reduced anxiety. You may feel more functional, more social, more outgoing. You might experience some side effects like sexual dysfunction, a bit of weight gain, but the benefits at this stage are clearly outweighing the harms. For many people during the honeymoon phase, they can feel really well and like the drug has been life-saving for them. The second phase is the tolerance phase. This is the phase where your body starts to adapt to what the drug is doing. Now, I'm going to quickly show you this graphic, but I don't want you to get overwhelmed by it. The point that I want to make is that serotonin acts in multiple areas in the body. Many people have the misconception that it just simply works on a part in your brain that helps you with anxiety. It's not true. It's involved in your cardiovascular system, your digestion, and even your immune system. Now, the reason this is important is because these medications disrupt the serotonin system, and the body doesn't like that. So it does something called homeostasis. This is where the body sends signals back up to the brain to tell it to adapt to the presence of the drug and push back against it so it can maintain its previous balance where it worked well. Now, what does this mean for the brain? Well, it means there's going to be a change in the density and the sensitivity of the receptors that the drug is acting on. Now, typically I see tolerance start to emerge anywhere from 6 to 18 months after someone first gets on the drug. This is generally where people will start to ask their doctors for an increase in the dose. And most people that I see generally tend to be maxed out on the medication within about 5 years. For some people, it can be sooner. And so that's going from like 5 of Lexapro all the way up to 20 within 5 years. Unfortunately, when many people hit the highest dose of the drug, they begin to report that the drug is much less effective. And this makes sense because the brain has now adapted to the effect. So people may feel like the drug is only working 20%, or sometimes they can feel like it's not even working at all. And this is when I hear people say, I'm not even sure this drug is doing anything. Now, the third phase is the worsening phase, and this is where the drug turns on you. And this is the stage that I see frequently, but I believe most doctors miss it. Many people who have been on these drugs for many years will begin to develop delayed side effects caused from the chronic load of the drug on the brain. And for antidepressants, I see a common trifecta of symptoms where they develop fatigue, brain fog, and low motivation. In the medical literature, the technical term for this is tardive dysphoria. And at this stage, what I notice is that most people are not doing well on the drug, and life begins to feel like an effort. And what makes this even worse is that they can go to their doctors, and their doctors misdiagnose this. They do not recognize it, and they tell the patient that they have treatment-resistant depression, essentially implying that something has changed with their brain or with their depression and it has morphed into this new treatment-resistant form. And this is when additional medications are often added. People will get on antipsychotic medications, stimulants, or mood stabilizers to augment the effect of the medication. But let's talk about what happens when they do that. They may work a little bit at first, but over time they don't really help, and the person gets worse. Why is this? Well, they're essentially trying to treat side effects by papering over them with more drugs. And as this happens, the person begins to accumulate more and more medications. And this leads to something that I call the cycle of polypharmacy, where someone gets a drug prescribed, it works initially at the start, they have a honeymoon phase, they become tolerant to the effect of the drug, it essentially wears off or becomes much less, and eventually it makes them worse. And then they get another drug prescribed, and then they go through the entire cycle again. And before you know it, a person is on 3, 4, even 5 medications which are not working. And what happens next? Well, the psychiatrists will move towards more and more aggressive interventions. They start to prescribe people things like ketamine or TMS or even electroconvulsive therapy. Now, this is really demoralizing for patients to go through. And at this point, they've been told by countless doctors that they have this lifelong severe depression, this sort of brain disorder they can't do anything about. And many of them stop expecting to ever return to their previous level of healthier functioning. They just think that they need to expect a life of disability now. Now, the sad part about this is that some people will decide that they want to taper off the medications. They will try and escape the cycle of polypharmacy when they begin to suspect the drugs aren't helping them. This can be really challenging. Firstly, many patients won't be able to find a doctor who's willing to taper them. Or if they do, the doctor will generally taper them way too quickly, and it will lead to a lot of withdrawal symptoms. Generally, the doctor will give up on them at the time and they'll say, see, this is proof, you need to stay on the medications. And at this point, patients feel broken and they feel stuck and they start to feel hopeless that things are never going to get better. And this is what I see in my practice all the time. People who got on these medications for entirely normal problems, things like stressful careers, loneliness, going through a divorce, they get put on medications and then 10 years later, they look back and they go, what happened to me? And so there you have it. Those are the 3 stages of antidepressant use. I want you to comment below if you or someone you loved experienced something just like this. And if you're interested in learning about how to come off these medications, be sure to check out my free training on how to do so in the link below this video.